Last week we were talking about all the different healthcare stories in Nova Scotia here. This week we're talking about healthcare stats. 80%, that is the number 80, the vacancy rate in one of the hospitals up in Cape Breton. So we're taking a look at many industries looking for employees these days, but there is just significant vacancy rates in terms of nursing here in Nova Scotia. So 80% vacancy rate for licensed practical nurses at Cape Breton Regional Hospital up in Cape Breton. Take a look down in that same facility, there's an 83% vacancy rate for nurse practitioners in the mental health and addictions unit there. Now, that is the worst stats, the highest vacancy rates in one facility there in specific units. But you look across the province and there are 18 different units where the nurse vacancy rate is 50% or higher. One of the worst overall regional centers is Cumberland Regional Hospital. That, you might remember, is the hospital that Alison Holtoff was taken to. She is the woman, the 37-year-old mother we talked about last week, who was taken to hospital on New Year's Eve by her husband complaining about stomach pain, waited for more than 6 hours to see a doctor, and died in the emergency department there. Now, what is happening in the hospitals? What is happening with these high vacancy rates, these sky-high vacancy rates for nursing? Well, we spoke with Janet Hazelton. She's the president of the Nova Scotia Nurses Union. Here's what she had to say about what nurses are going through right now.
We have new grads coming in, we have senior nurses retiring, we have nurses, the burnout is really high in nursing. People are not getting their vacation, they're not getting their time off. So they're just saying, like, I'm either reducing from full-time to part-time, or I'm leaving altogether, or I'm moving out of the province because I can't handle this.
So leaving altogether, moving out of the province, it is a cycle that's getting worse and worse with people leaving the profession. Makes it harder on those still in the profession of nursing. Heather.
What is the province doing then in the face of this incredible shortage, Brett? What is it doing to address the issue?
Sure. Well, not an easy issue to solve, obviously. The province released a statement, provided a statement to CBC News, saying that they understand the immense pressure that the nursing staff and healthcare professionals are under in Nova Scotia, and that there needs to be changes, and that the government continues on saying that they are prepared to do everything they can to help healthcare workers as well as Nova Scotians. Now, we also heard from the Office of Healthcare Professional Retention talking about they're in charge of bringing people here, trying to keep people here in the healthcare system. They said that the government invested $340,000 this past summer in August to try to encourage more international healthcare workers to come here to Nova Scotia, and that Nova Scotia has among the highest financial incentive programs anywhere in this part of the country. So the union says that there needs to be union staff, the employer, the health authority, and government all sitting at the table to try to work out how to solve this significant problem.